6.4, presentation of proclamation designating the month of April 2025 as Alcohol Awareness Month in Lake County, and Vice Chair Rasmussen will read this proclamation. If you're here for this, please come up and stand with Vice Chair Rasmussen.
All the way. We won't bite, I promise. Come on. I don't bite them. Indy's very nice.
A proclamation designating April 2025 as Alcohol Awareness Month in Lake County. Whereas the month of April is dedicated to increasing public awareness and understanding of alcoholism and misuse, its causes, effective treatment, and recovery. And whereas excessive alcohol consumption is a significant public health concern, contributing to numerous preventable injuries and chronic diseases. It impacts adults and youth of all racial, cultural, and economic backgrounds. And whereas the entire community plays a vital role in supporting those struggling with alcohol misuse and addiction while promoting a culture of moderation and responsibility. And whereas education and prevention efforts are crucial in reducing the stigma surrounding alcohol use and misuse, and encourage individuals to seek help when needed. And whereas in the calendar year 2024, Lake County Behavioral Health Services provided DUI program services to 563 participants, assisted with 566 substance use treatment service requests, and offered treatment service to 256 individuals. And whereas in Lake County, 22.3% of youth aged 12 to 17 have engaged in binge drinking, a rate more than 5 times the state average. And whereas the Board of Supervisors and Lake County Behavioral Health Substance Use Disorder Services urges all community members and organizations in Lake County to participate in activities and events aimed at educating themselves and others about the dangers of alcohol misuse and addiction, and support initiatives that promote healthy lifestyles. Now, therefore, be it proclaimed, the Board of Supervisors of the County of Lake join with the Lake County Department of Behavioral Health Services to hereby proclaim April 2025 as Alcohol Awareness Month in Lake County. Passed and adopted this 22nd day of April 2025 and signed by our chair, E.J. Crandall. I just want to thank you all for your work in this area. It's very much appreciated.
Thank you.
You want to speak? Elise?
Thank you. Hello, I am Elise Jones, Director of Lake County Behavioral Health. And I think this is the first year that I recall that we had young people up here for this proclamation, and that's really exciting and fun for me. I remember being a young person and making some really awful choices, a lot of them that involved alcohol use, and especially for young women, and I see young women up here, you have to really be safe and take care of yourself. And so you're up here being leaders and showing that you can have fun and like do cool stuff without that. So thank you for your willingness to come up here. I will stop talking directly to you. Thank you.
My name is Richie Okino. I work for Lake County Behavioral Health Services. I wanted to talk a little bit about alcohol and it being Alcohol Awareness Month. I'm in the school system every single day, right? And I'm dealing with students
Hi, my name is Amber. I'm gonna look this way because we don't have many people out this way.
You all came up.
But thank you, Chairman Crandall and the board for acknowledging Alcohol Awareness Month. It's really important for us to come here and really highlight all of the different type of work that we're doing around alcohol in terms of prevention services, early intervention services, and treatment. If you look here, we have an array of that continuum. We have prevention services occurring. We have young people who are working hard around prevention. We have representation of early intervention services and treatment providers. We have to wrap our arms around alcohol awareness through all aspects, because it's not just about prevention, it's not just about early intervention, it's not just about treatment. Everybody experiences alcohol, and it touches and it affects their lives in different ways. So that's why it's important for me to highlight that. And I'm so grateful for everybody who's here and who touches different aspects of people's lives. I did want to give an opportunity. Laura, did you want to say a couple words? But I also wanted to give an opportunity for our senior counselor, Paul Verhey, who leads our DUI programs and who will also be leading a grant that we just received from the Department of Healthcare Services and the California Association of DUI Treatment Programs. It's called the DUI MAT grant, and it allows us within our DUI program that we run through the county to provide early intervention services to individuals who may be also experiencing opioid and polysubstance use. So it is our third award, yes. They really like what we do in Lake County. We hear on a state level that we do an amazing job in our DUI programs, and we are very innovative in the way that we approach and treat people in those programs. So, Paul, did you want to say a word? Thanks.
Unfortunately, more than just a few. My name is Paul Verhey. I'm a senior counselor with Lake County Behavioral Health Services. I oversee the DUI operations primarily. I apologize. I'm still pretty shaken by the powerful poem earlier. I'm glad I wrote this down. First of all, most people are not aware of the fact that DUI programs across the state are mostly private and run for profit. I am proud that as a public agency, we can keep our fees low for Lake County residents. Not surprisingly, nearly all our beneficiaries were under the influence of the drug ethyl alcohol when they were arrested. Studies show that about 1 in 5 individuals receiving a DUI for the first time have an alcohol use disorder. So that's only 20%. But that number is 2 out of 5 for clients with more than 1 DUI, and those numbers double if we zoom out to 5 years down the road. So like our dynamic outreach and prevention team, DUI counselors seek to prevent and intervene early in the development of those substance use disorders. DUI is treatment. It's an opportunity to evaluate one's drinking behaviors against the backdrop of one's personal goals and values, and to become motivated to change. Am I able to moderate? Am I happy with 1 drink a day, 1 standard drink a day for a woman, or 2 standard drinks a day for a man, max? There's no such thing as no risk drinking, but that would be lower risk. DUI can also be a portal to receiving enhanced care, and for our many Medi-Cal beneficiaries, the organized delivery system ensures there's no wrong door for that. Clients can take advantage of our in-house addiction medication program, MAT, and our MAT grant will be really instrumental in bringing more people into those services, which we do up in Lucerne. Enroll in outpatient treatment with our SUDS team, or transition to higher levels of care through partnerships with outside agencies like Archway Recovery Services. Thank you, Amber, for so much of this. I would like to contribute to alcohol awareness by sharing some statistics. In a 2023 study, 21.5% of Lake County adults self-reported heavy or binge drinking behaviors. By contrast, 30% of Americans do not drink at all. Most people know that excessive drinking can damage the liver. Per capita, between 2018 and 2022, Lake County ranked first out of California's 58 counties in deaths due to chronic liver disease and cirrhosis, a rate of 42.9 out of 100,000. By contrast, the state average is 13. We are 6th in fatal car crashes per capita due to alcohol. At the federal level, the CDC estimates that excessive alcohol use kills about 178,000 U.S. residents every year, making it the most preventable cause of death after smoking, high blood pressure, and poor diet. Tobacco ads are almost entirely banned, but nearly $2 billion is spent by the beverage industry every year. I'll finish up. Alcoholic deaths, which rose almost 30% during the COVID years and after, are slow and painful. I witnessed this personally in my mother this past year, who passed away. And I was born with a predisposition to the disease. I began my recovery from alcohol use disorder in 2010, but had numerous setbacks. Unfortunately, the shame surrounding my relapses and my limited exposure to treatment options kept me drinking. I got lucky. A local nurse with an addiction specialty recommended integrated co-occurring treatment, peer support, and medication. That cemented a lasting sobriety for me, and I'm forever grateful for his expertise and genuine care. I believe our SUDS team at Behavioral Health has those same qualities. Wherever possible, we are challenging barriers to recovery, including stigma and the old school one-size-fits-all or all-or-nothing thinking that can interfere with harm reduction. I appreciate the opportunity to speak about our work to prevent and reduce harmful drinking behaviors in our community. Thank you very much.
Well, thank you.
Hi, I'll try and make this quick. I'm Laura Sullivan with Redwood Community Services, and I think we'd be remiss to talk about alcohol misuse and not talk about its effects on pregnant and parenting women. We know that the serious and lifelong consequences that come to both the mother and the child from drinking during pregnancy. At Redwood Community Services, we offer both residential services as well as now outpatient services. And outpatient services come with childcare for children up to the age of 12. So if you or someone you know is struggling as a pregnant or parenting person and needs support with their alcohol use, please encourage them to submit a referral through our website at redwoodcommunityservices.org. Let this proclamation today be a powerful step forward, not just in raising awareness, but in providing real solutions. Together, we can build healthier futures, and we'll do that one family at a time.
All right. Anyone else would like to speak? Anyone from the board?
I will. Yeah, I just want to thank all of you for coming today. We have a lot of different partners here that are doing this work together. You are out on the front lines working on intervention and prevention and treatment. I know we also have another proclamation coming up right after this that talks about culture change and shift and modeling behavior. So I'm glad to see them working together. And so my comments are just going to be a little bit sandwiched in between. You know, a lot of us grew up in culture where we really glamorized alcohol, and it's a lot of work to model better behavior and better options, especially for our kids and our families growing up. That you don't always have to have alcohol involved at functions or to have a good time. It's really important to be modeling that behavior too, especially when we've got family members battling with addiction issues too. You want them to feel welcome and involved and loved. So thank you.
Go ahead.
I think it's always rough when culturally acceptable things can be absolutely so harmful, whether we're talking about tobacco or whether we're talking about alcohol. It doesn't just have the potential to hurt you as the individual with your health, but the outgoing consequences around your family, around your friends, around your community, whether you're driving and total strangers, you could have that impact as well. So it's difficult to overcome the hurdles that society has said these are absolutely normal things for you to engage with. Inebriation is a problem because you want to get back to that same feeling you had the first time you started, and that means doing more. And unfortunately, the more you do, the more harmful you become to yourself and others. And so it's difficult. I'm glad we have services that people can access to try to kick those bad habits because they are harmful. So thank you for all your work.
Supervisor Owen?
Yes, thank you, and thank you for being here today. I know growing up here locally, peer pressure was huge, and instilling the strength in our youth and our young kids and letting them know that that they have the strength to say no, because it's much easier to say no when you're young than it is once it gets a hold of you. So having that courage and that inner strength to ignore the peer pressure and not give into it, that's huge. So I applaud you. Thank you.
Yes, appreciate this proclamation, and I appreciate all of you speaking, especially you giving the insight about in front of children and whatnot. Grew up in a home in a generational alcoholic family. And then, of course, in the military, it enhanced problem-solving skills for me were just to run to the bottle. That's all I knew. And so to this year is 9 years sober for me. It's a good thing for me because I'm so glad that I am sober, because every time I go to like a RCRC or CSAC, they just like, it's like open bar, like, and I'm like, man, it's a good thing, because but and a little part of me in the back of my mind's like, man, where was this 12 years ago? But then again, I would have been a fool, right? And that's what led me to wanting to stop, was being a fool, because that's what it did. It never ended. It kept more and more and more. There's like an image that people had put out before, that there's a bottle with a hook in it, and that's what it is. And it ruins relationships with families. There's a dysfunction that comes in place, and that perpetuates in your family dynamic. And it takes so much more when you go through the programs and you have to take accountability. You also have to undo all of the bad habits that you taught to others around you, especially children. So again, I'm glad we have this, and I just wanted to share that with you all. Is there anyone else from the public maybe that
I know I've spoken on this before. I didn't know the level of strength that marijuana now possesses, because I came from the time right after the 60s as a child, and we were highly educated on why not to start with the gateway drug of marijuana that was taught to us in schools. And it is a gateway drug. And as you make policies up here, think of those children who now, because it's been legalized, President Obama legalized that, it gives one less step for children at a party to say, well, it's illegal. And that's actually a safeguard that used to be there for people in my generation. So it's very hard. You can get up here and say, oh, it's easy it's not easy. When you're with a friend, and I watched my cousin go through the 60s and really get hooked, but they didn't know the damaging effects of that. So we learned, and our parents made sure we knew, but it is a gateway drug, and we are promoting it in this community. And I really want to implore you, as you make policies, to think of these faces. And that's just a symptom of what's wrong in this community. Find out what the actual cause is. Give them more opportunities to do fun things, because like one of the supervisors said, if you have happy things to do, you won't choose that route. Thank you.
Thank you. Is there anyone else on Zoom or anything? All right. Well, thank you again, and we will definitely get this picture.
Sorry, I've been waiting for the right moment.
Hold on.
Oh, yeah, okay.
I'm just letting these guys.
Yep, that's it. That's it.
Oh, wait, okay. Oh, look, there we go. Okay, there we go.
What a good job. Aaron, look this way.
Pretty lucky. So then one more.